Hello, welcome to another evening on the B Plus platform. B Plus means be positive. Be positive is the A plus way to be. With that thought, we are trying to assemble people with point of view that the tomorrow that we are going to get is going to be really, really helpful for us. It's going to be a hopeful way that we're going to lead into the world tomorrow. Getting all the people with similar positive energy into one platform, doing things that are going to generate that energy among ourselves, also with people that we are connecting with in every day of walk of life. With that idea, we are trying to do this from 8 to 9 on YouTube and Facebook, so we can generate that positive energy as a combination of people together. With that, hopefully we can resolve any issues that we are facing internally with ourselves, and perhaps as a society, as a team together, we can help part of the society of issues that are faced in society. Right now, world is faced with multiple issues at this point with respect to COVID-19, as we know, has been already having an impact all around the globe. It has no boundaries, it has no color, it has no caste, it has no levels of distinction or differences when it comes to having an impact on humankind. It has close to 7.5 million cases all around the world, almost 2 million just in US. And there are pockets of the economy that's opening up. There is protests that are going on as far as US is concerned. So the world is really faced with multiple dimensions of problems. And in these kind of situations, that are the people that are really, really helping humankind are of a unique breed. We have been having them all around with us for ages. They've been the saviors of humanity for multiple generations, as we know. And now, especially given the current conditions, their profession has become of paramount importance. And they are nothing but the doctors and the healthcare workers and everybody else that support them in this fight against this pandemic as a humankind together. And today, I have the privilege of introducing an extremely elite panel to you to discuss just about this situation on COVID-19, see what is being reflected from their fields of expertise and their experiences as they deal with this pandemic on a day-to-day basis. And they're going to be talking to us from their perspective, and we're also going to talk about a very interesting topic. As I introduce the panel, we will discuss what the topic is about. And then today, for whoever is watching on YouTube, please chime in with your views as you follow the doctors that are going to present on this topic. So your questions, I will relay them to the panel, and then they will answer to the extent of their knowledge. With that, I'm going to introduce the panel today. Hello, all welcome. My name is Bhaskar Rayavaram, and thank you all for dedicating an hour from your very, very busy day and for accepting to be part of this panel. We have the panel today is in a very extremely intelligent and experienced panel. So we have one of the country's most renowned cardiologists, Dr. Srinivas Gunukula. He lives in Richardson, Texas, so he is part of the panel today. And we've been trying to get him on this panel for quite a few weeks, actually. But he's been so busy dealing with this situation that we are all faced with. And we are very fortunate to have him on today. And then we have Dr. Parul Kaushik ji, who is infectious disease expert, HIV physician, works at Collin County Medical Center in Plano. She's been on this panel once before, but her knowledge on infectious disease field, dealing with this current situation, will be extremely helpful. And we have Dr. Nandan Rayavaram, who is a family medicine expert who lives in Kuwait. So he's going to be speaking to us. He's been pretty much part of this panel since this is our 4th time we are bringing a group of doctors together to discuss. So he's been part of this panel since the first program we did. So he's going to be offering perspectives from that part of the world, see what's going on with respect to COVID-19. And Dr. Manoj Maddali, who is actually he's in his 3rd year at the University of San Francisco. University of California in San Francisco. He is volunteered to be in the ICU for COVID-19 situations. And this is his 2nd time on his this panel, but he's going to be talking about, we were all going to be talking about. So he's done some extensive work on this particular situation, also has studied the emotional burdens of COVID-19. And that's going to be one of the featured topics that we'll be talking. And then we have Dr. Sharmila, who is a pediatrician from Hyderabad, India. She works at the Apollo hospitals. And she's been on the panel before, and then she'll be offering the point of views from Hyderabad and the Telugu states and in India as well. And then we have Dr. Vivek Rustagi, who is from New Delhi, and he is his expertise is in psychiatry. So he's a psychiatrist working in New Delhi for Delhi prisons. So he deals with this problem from a different perspective. So he'll have lots of ideas, lots of thoughts around the emotional component of COVID-19. I would like to thank Dr. Parul ji for introducing Vivek sir for this panel. So with that, I'm going to welcome you all. I will unmute you. And then as part of this program, every day I'm doing different kinds of programs. Whenever we do at the beginning, what we do is we are very thankful for being safe in our houses, following whatever prescribed formula from experts like you all. But we are also doing, as part of the program, is recognize the fact that there are many people that are putting their safety at risk, going and serving the humankind. We want to take an opportunity to clap for them and pray for their safety. It's a small panel, but the resonance reaches across. So let's clap for all the people like you that are working for this safety of our humankind. So this is for all the healthcare workers and everybody else that is working for us, for our safety. And then as part of the program, we're also raising $100 a day. Whoever is watching, please see the YouTube description. There is a mechanism for you to donate. This $100 will go towards the priests that doesn't have any professional work right now because of this situation. We are helping to feed them for their daily needs. So we're going to be collecting $100 a day for 30 days and send that money across to the people that are serving us, that are serving this particular situation back in India. So that, with that said, I'm going to be opening up the discussion today. Let's talk about initially for about 25 minutes or so, the global update on COVID-19. I call it global because we have a very eclectic panel. I'll start with Dr. Gunukula garu. Sir, we've been trying to get you on this panel for some time. So I'm going to focus on you right now. So you tell us about what you see right now from your experience with respect to COVID-19, from all aspects, from how we started, from where we are opening up the economy, and the second wave, do you see it, and what is going on?
Thank you, Bhaskar. I'm sorry that I could not join earlier. Work has been busy. It's with a lot of sick patients. So I'm on call frequently, so that makes it a little difficult to join. But happy to join and happy to give and hello everyone to all the other panel members and all the audience and the viewers. Well, since this has started, it was in India when this started, and I saw the news and heard the news that it's going to be shut down. So I had to rush back to US. I landed just in time on March 13th. I think I landed at 9 p.m. At 12 midnight, they shut down everything. So I just barely made it back to US. And since I've come back, I've been to work, and it's been very stressful, I should say, because initially we didn't have that many cases in Texas. I'm based in Dallas, Texas, just to clarify. So right now, these cases are steadily going up in Texas. I think right now we're number 2 in the country after California as far as daily cases wise. Like yesterday, I think we are about 1,700 or so cases in Texas, like whereas California had more than 3,000 cases, I think. So even New York, New Jersey are down below us now. They're 3,000 cases, which is a good thing. So this is real. There are some people who are thinking this is farce, and I have patients who come to my office. I also do both office work and I work in the hospital. I take call in the hospital. So I've seen both sides. Outpatient, there was significant drop in the office visits. Everybody was scared because of the lockdown and nobody would come. We started doing some telemedicine to patients who are technically savvy and some phone calls, phone visits to the patients. But now things are slowly opening up. The volume has picked up now. I would say we have about 70 to 90%, depending on the day, the patient are coming to the clinic. In the hospital, there was like a week ago, we didn't have any ventilators left. We ran out of all the ventilators. In fact, the state of Texas has given about 15 ventilators to one of the hospitals where I work for additional patients. So it's real. And also it's just not affecting people with COVID. It's even people who are coming with other problems, they're also getting affected. Like, for example, I had a patient who came in, elderly lady. She's not COVID positive, but unfortunately, because of these problems, nobody's being allowed into the hospital. Only patients can come, no visitors, none whatsoever. So this lady was in her deathbed. She didn't want anything to be done. Her daughter wanted the same thing. So luckily I know them. So I used my phone and let them FaceTime. And they were so thankful. And yesterday, in fact, the daughter came to visit me in the office as a patient. And she was thanking for giving that opportunity to do the FaceTime before her mom died. She literally died at hours later. She could speak to her mom, so she was. So it's taking a lot of toll on a lot of people. So she was expressing her angst about not being able to spend her with her mother. And she, it's tough time for a lot of people, even patients. When I see in the office, every other patient has gained weight because they're all staying home, no physical activity. I think, everybody's eating a lot, no physical activity. I think that's a common theme. And also, some patients have openly expressed that they're feeling suffocated, they're feeling, they just don't feel right. There's a lot of anxiety in them. And I've been trying my best. I'm not a psychiatrist, but trying to give them reassurance, try to how to cope with this situation, stay busy and stay active, focus on their health, focus on, have a schedule for themselves because they're not able to go out. They're feeling suffocated at home and they're not able to do their usual activities, no social gatherings. So I think that's taking a lot of toll on a lot of people. So I think the way it's not over yet, at least in Texas. Other states, it seems to be coming down, but at least I would say 15 to 20 states, the numbers are going up. So that's worrisome. So it looks like we are to, one thing I can tell people is don't take it easy. Just follow 3 basic things. 1, please wear a mask. You're going to protect yourself, you're going to protect others. 2, basically wash your hands. And third one, most important thing is maintain the social distance. If you do these 3 basic things, I think you'll be safe. And also the other myth is a lot of people are thinking that that's not true. We're seeing all kinds of people, young, old, everybody. So that's not true. And also there's a no pattern. That's another thing. I've practiced, my 17 years of practice, I could make a decent assessment that who's going to live, who's going to die. Unfortunately, with these patients, I should admit that I'm humbled to say that I've been proven wrong again and again, that whom I thought they're going to make it, they have died, and whom I thought they're going to, aren't going to make it, they have made it. So it's just a very strange experience because it is involving multi-system organ failure. And also I have to do some emergency procedures on patients. So we've been taking the precautions because if they come with a heart attack, we screen them if they are COVID suspected for COVID or not. If they're not, generally, then we proceed with the emergency primary angioplasty. Otherwise, if they are COVID positive or suspected COVID, generally we are trying to avoid because the data shows that to protect the staff, and also looks like the benefit is not there. We're giving them what we call as clot busters. We're giving them medications to lyse those clots and trying to medically. At least that's the summary I can give in a short. I'll let the other speakers say.
Okay. Thank you, Dr. Gunukula garu. So we're going to go to Dr. Parulji and then have her speak about her perspective. Dr. Parulji.
Oh, yeah. Thank you so much, Bhaskar ji, for inviting me again. And I think this is a big honor. I'm really glad to be on this panel. I was trying to, get some, there's so much information always, which is good about COVID. So I was trying to get to some things that, might interest people. One, I think very important that which has been in the news a lot is about the study. And this is like an update, actually, more of the recent updates, hydroxychloroquine. I think this has been like one of the most controversial drugs. Does it work? Does it not work? And I think one of the things that I did mention in the last panel as well, that we cannot get ahead of ourselves. We'll have to wait for the data. And this is really what happened. The study got published. People got disappointed that the hydroxychloroquine actually increases death. In fact, it's the mortality is high, so should not be used. CDC came up with this that definitely do not recommend it. A lot of guidelines were made, and then Lancet retracted that study, saying that they actually didn't have the real. I mean, the study, they could not verify the data. So I think this is kind of important to understand that we're kind of like back to square one. There are a lot of studies going on, and it will take some months for we to have something like more concrete. The treatment pretty much it's similar, that is tried. There are different treatment modalities that we had talked in the past as well. The most important thing is still for majority of the people, because they want to know if they get sick, is there a treatment? I think the key to understand, at least in the US, and I think that's probably with a lot of other countries as well, but definitely in the US, the treatment is reserved for sick patients who are hospitalized. There are some doctors that are giving hydroxychloroquine, a few others like maybe outpatient, but according to the recommendation and what majority is doing is actually reserved for sick patients. And a lot of these treatments are reserved also for like patients who are in ICU and in sick on ventilators. So I always tell people that don't think too much about the treatment at this time, because you do not want to go to ICU. Because when somebody is that sick that their oxygen level is going so down that they need a mechanical ventilator, the chances for them to survive is actually does go down quite significantly. So as Dr. Srinivas said, yes, the key is prevention at this time. And I'm really concerned about Texas as we are opening. Cases have been consistently going up. Hospitalization has been going up, and definitely all type of patients. We are seeing it's definitely not about comorbidities. There is a higher risk with comorbidities, and I want to make a point here, which I recently read, is that asthma is, in some studies, have not been found to be a higher risk, because a lot of asthma patients are worried. Again, it by no means it means that asthma patients should take it lightly, or anybody really should take it lightly. But I think it's a little bit reassuring. Some of my HIV patients asked that as well, and I think it's reassuring that we do not consider that to be a high risk, at least in the studies. Kidney diseases, heart disease, diabetes, obesity, and actually dementia is also considered a high risk, in some of the recent studies. One additional thing I want to mention is that there was a study in Lancet, which was recently published, in which they talked about that the patients who were COVID positive and they underwent surgery, what is the risk of complications? We know that anytime surgery is done, there are risk of complications. But in general, there is always different studies, different surgeries have different, post-operative complications or perioperative complications, as we call it. But patients who were positive 7 days before the surgery and up to 30 days after the surgery with COVID actually positive, were found to have a much higher pulmonary complications. So it is, at least based on that study, they highly recommend that patients should not undergo elective surgery. Elective means something that is not necessary or can be waited. Of course, things that are urgent need to be taken care of, and things are opening, offices, hospitals, and are now doing, at least the elective, or at least the non-COVID related issues are being handled, which is good. But I think that is something for people to know that. One additional interesting thing I found is that in Peru, actually, there is, when we talk about global and we talk how the cases are rising, one interesting thing to note is that in Peru, in the Andes area like Cusco and really high altitude, there is a very, very low rate of COVID infection. And I think this is interesting because it is a very touristy area. And when it started, it was worried, there was a worry that because, of the heavy load of tourists there, it's one of the major attractions, tourist attractions in the world, that there's going to be very high cases. But interestingly, we still don't understand what altitude has to do with it. But they're finding that similar things in other high altitude areas. And I would be, it would be curious to see with there are a lot of people in all over the world that live in high altitude, that what their rates are. But I think it is interesting to see that. I think those are mostly, there is definitely a lot of concern with children, and I think Dr. Sharmila could address that. With children and COVID, I think that's kind of like, again, back and forth. Initially, it was believed that it is not affecting much, and then with this Kawasaki disease and other concerns with children came. I still think it is they are at low risk, but again, they could be carrier and they could spread it. So I think those are pretty much the latest updates. I just want to end with this introduction with what Dr. Srinivas said, that at this time, the only thing that we need to do is prevention. And I am really concerned because I feel that the cases in Texas are going up. We definitely opened early, and still, despite cases going up, there are a lot of people that I see outside. It's good actually to go to the park and as long as you can do social distancing, and that's good with summer, Texas summer. But I think I'm really concerned about, like, a lot of even my patients actually tell me, I don't go to restaurants. It's okay to get takeout. I always say that it's okay to take takeout, but sitting down and crowded restaurants, and my patients tell that I went there and they were like, it was crowded. I said, no, don't go. So I think that's what I'm really worried that. And of course, with the protests and Memorial Day weekend that we had, cases have been going up. So I think that's really a big worry.
Those are excellent inputs, Dr. Parul. So we're going to go to Sharmila ji next to see all the way from India, see what her perspective is. Sharmila ji, please take 2-3 minutes to give your update.
Yeah. Hi, everyone. So I think I'll try to be very brief. What is concerning me as a pediatrician? You must be already seeing it on news that the cases are going up in India, particularly in the place where I am, Telangana. And more so, maybe more than half of the cases in Telangana that are turning positive or being recorded, they're more into Hyderabad, the place that I'm right now in. More than that, as a pediatrician, what is it that I would want to say is, I think those are the ending remarks of Parul, and I'll take it up from there. This Kawasaki-like illness, or the pediatric multi-system inflammatory disease, PIMS, I'll not say there are many cases reported as of now in India, but I can tell you why it's not so. First thing is, it's usually after a month after the peak of the cases get in, and then after the month is when this immune reaction kind of presentation starts. So I think it's yet to be there. The other thing is, I think with regards to number of cases or number of deaths or the way it is presenting, when I see the articles and all the information that is being floated across, when you see that across the world and as of India, there are two things that I would like to note. One is, in India, we are behaving definitely differently. The fatality rate is probably one of the lowest when you compare the number of cases and the deaths. And that is the silver lining to the cloud. That is what is making us feel good and better. But maybe that is also giving a false sense of assurance. And we are yet to see the actual picture in India, which right now we are going through. Once the lockdown is lifted, there is a huge surge of cases, but I'm still happy there is no surge of deaths. So definitely the way it is presenting in India, I think it is it's very it is showing its milder form. And when it comes to pediatrics, I am seeing quite a few of different presentations. The thing here is you must already be reading that testing is very less. But then I have my own take on whether it should increase or not. I won't say that you have to test too much, because we have passed that phase where we can test, and testing is going to impact containing the disease. I do not think so. But testing definitely tells us the way it is presenting, more extensive testing. And if I have to put it across to anyone who can influence the government, I think testing should be allowed into the private sector. And pediatrics, I've been seeing these cases with fever and atypical rash, fever and more of gastrointestinal symptoms, loose motions, and a couple of them with vomitings, wherein the serological markers in couple of them are like the ferritin, LDH, D dimers, these are high. But the restriction of the testing, meanwhile, that as the child gets better, they're all self-limiting. Parents are very reluctant to go to the nodal centers to get tested. And there is this back and forth policy also allowing, thinking about allowing private hospitals to test right there versus not allowing and the samples being sent across. In this changing dynamics, I would definitely have to say that testing is uh, not enough, but I think they're revamping. But I will also concur with the government in this one point that extensive testing is of no use at this point. I do concur with the government with that over that, but maybe a little change in the guidelines. It's not just the respiratory illnesses or someone who has a history of contact with a positive case. These are the cases which are being allowed to test. I think you should test people with atypical presentations too. With this, I will let the other people also
Yeah,
contribute.
thank you, Dr. Sharmila. So next we'll go to Dr. Vivek. Sir, I don't see your video.
Yeah,
Yeah,
thanks, Bhaskar ji, for inviting me on this esteemed panel. Since my topic is about the psychiatric or the emotional burden, and specifically about the updates, I must tell you that, like the previous panelist did mention, that in India it is an escalating situation, and we are going towards an unlocking. And obviously, there are a set of emotional problems. There are general emotional problems in the community. People are having anxiety specifically because of excessive news that they are getting, excessive discussions amongst themselves, which are lay discussions. But apart from that, a blind spot is the worsening of pre-existing mental illnesses. Roughly 5% of the population suffers, and even at least, even if we assume that only 20% are in treatment, what is happening is these people are not able to get the proper treatment, and because of the scenario, they are having worsening of their mental illnesses. Uh, because India is grappling with a situation which is, unprecedented, there is a lot of diversion of the staff also. So in government setup, we see that psychiatrists are also doing the COVID duties. So what happens is that the availability of psychiatrists reduces. And this is one important blind spot. Apart from that, the another blind spot that I would like to mention is the emotional burden on the medical staff. Initially, the medical staff was, grappling with the shortage of the PPE kit. And once the quantity sufficed, the quality started becoming dubious. So that is another area where these people are struggling. The government infrastructure, as we already know, in India is slightly on the deficient side, and now the private sector is being roped in. I mean, it's more like being forced in, and there is a significant loggerhead between the dispensation and the medicals. So, all in all, a significant emotional burden on the medical staff, who otherwise also is already on the risk of contracting infections more. And taking from my experience of a custodian setting, for example, India has about 4 lakh prisoners across the jails. But not only prisoners, there are other people who are dependent on the state and state-run shelter homes. These people have nowhere to go. And knowing that a custodian setting is a very ripe place for spread of infections, this is also causing a lot of emotional turmoil. And so these 3 areas I wanted to highlight, which are coming up more as more and more we are going into the pandemic. So that's what I would like to say for the time. Thank you.
Yeah, thank you, Dr. Vivek. So we'll go to Dr. Raghu now and then see what he's seeing in Kuwait and that part of the world. Dr. Raghu, you're on.
Yeah. Hi to everyone. Namaskar. Maybe panelists will kill me if I say that I want to start with the green line is flattening. Green line is rising and red line is flattening. I mean, the number of new cases, yes, for sure it is going up. The number, it will be there for next 2 months, it will be there. So for us as a physician, as a doctor, what we are seeing is a green line is also rising, the cases of recovery. When I saw last time, it was, you can say 2-3 weeks, it was 1,000 to 1,400 reported here, and the recoveries were hardly 400, 300, 200. Now this number is coming down to 400, and this number is going to 1,000. That shows somewhere some hope, because it is about emotional distress of the physicians and the patients. I want to start with a hope that we are reaching the plateau of the infection, and probably in 2 months of time in Kuwait and the Middle East area, we may come down to the normalcy. That's what I feel. And adding on to the treatment modalities, please don't, as all the panelists are telling, don't worry about anything. There is a diarrhea of papers every day happening, 80,000 papers already published about COVID. This is all for medical people. Please, as if people who are watching on live, don't look into those data. Prevention is the only treatment for you now. Stay home, stay safe, and wash the hands and maintain the social distancing. As I said last panel, world is open for economy's sake, not for you. You are 100% needed. You do your job outside. Otherwise, try to learn other way of living, staying at home and living happily. This is what I said. And take over to Manoj, next panelist.
Thank you, Raghu. And I'm going to take, last but not the least, Dr. Manoj Maddali, who is the youngest of the lot here. He's been doing some very interesting work in this field. He's volunteered himself to be part of the ICU for COVID-19. So he's seen these things much more closer in action. So Manoj, you are on right now. So give us your perspectives in general, and then what we will do, since you are the one who is going to speak about this topic to start with, for the emotional burdens of COVID-19. So as you finish your update generally about COVID-19, what you're seeing, you can segue into the main topic of the day. Okay.
Thank you for inviting me to this talk. Namaskaram, everyone. Instead of a medical update, I just wanted to talk and relate what's going on with COVID with what's going on in America from a political standpoint and the protests that are going on. So we know that America has structural racism and differences between races and ethnicities. We know that there's data that shows that Black Americans are more likely to be, stopped by police, killed by police. There's more Black Americans in jail, but Black Americans are also disproportionately affected by COVID. And And that's something that has not gotten enough national attention, in my opinion. So just to share some data with you, so nationally, about 13% of America is Black, but about 20 to 25% of the deaths totally are Black. So they're on average dying at about 2 times the rate that other non-Black Americans are dying. In fact, for white Americans, it's a lower disproportion, compared to the percentage of people who are living in America, the percentage of white Americans who are dying is less. So there's on average 2 times. There's some states like Michigan, Wisconsin, Montana, where that number is about 4 times as many. So 4 times as many Black people are dying relative to what is their prevalence in the population. And this number is also high for hospitalized patients in addition to deaths. There's a number of reasons for this, which is that on average, Black Americans tend to make less money than their white colleagues. And because of that, they tend to live in more densely populated areas or tend to live with other people at home with larger households. So you can imagine where more people would just be getting sick from that. They're overrepresented in jails and detention centers, and we know that there are outbreaks in those areas. And then finally, there are more Black Americans living in, working in the service industry, like in fast food, and those are considered essential workers and they have to go into work. Whereas many Americans, I know, for example, in San Francisco, there's a large tech community, and that's a privilege to be able to work from home that many Black Americans don't have. So I just wanted to take the time to address that what we're seeing in America in terms of protests and people being angry at what they see as structural racism is not just about police, but it's really about health as well. COVID-19 is just turning up the intensity of what people are seeing. So with that, I
was saying the very important points that you brought up. Thank you for that.
Thank you. So I wrote an opinion piece about a month ago about an experience that I had with a patient in Bhaskar. If you can send the link to that piece in the chat.
Okay.
But essentially the story, I was working in the inpatient side of the hospital, and I admitted a 96-year-old man to the hospital. He did not have COVID. He actually came in for a different problem. And he had actually come from a nursing home. And so he was admitted to a hospital, a different hospital about 2 weeks prior, and was discharged to a nursing home because he broke an arm and needed rehabilitation. And his wife was 95 years old and was not allowed to visit him at the nursing home because that's when COVID was starting. And so for 2 weeks, he didn't have any visitors, and the nursing home staff actually didn't let him talk to his wife. And I think there was a phone call, the wife said, of about 3 minutes over 2 weeks where she got to talk to him. And they'd been married for about 75 years. That's almost 2.5 times as long as I've just been alive. So I admitted him to the hospital after he had already not seen his wife for 2 weeks. And my hospital at the time had a policy where there were no visitors to the hospital unless the patient was actively dying, so that they could spend the last moments with him. And so we tried to treat this man for several days, and he just wasn't getting better. So we transitioned him to hospice care, and he was going to die in the next couple of days. And that's finally when his wife was able to visit him in the hospital. And by the time that she visited him, he wasn't talking anymore. He was in the process of dying. And as I reflected about it, in the last 20 days of his wife wasn't there for 15 of the last 20 days. And the last 5 days that she was there, they weren't able to talk anymore. So it told me that it was a tragic end to what was 75 years of marriage that was a result, of healthcare professionals doing that to them. And I think it's, we can debate about if it's necessary or not necessary for there to be patient visitor restrictions in the hospital. At least at that time, it seemed very reasonable. I know that my hospital now is changing that. and visitors allowed to come into the hospital with masks, and more visitors can come if they get their own COVID test. So to the point that was made earlier in the group is that, there's the medical aspects of COVID, but then there's a huge emotional aspect of COVID that is equally as big, I think. When patients or their loved ones are feeling isolated and lonely, there's a huge loneliness epidemic that's going on. The patient himself was lonely, and then the patient's family members are lonely. And then I think someone had mentioned the healthcare workers feeling the emotional burden as well. Because I feel guilty that because of me taking care of him in the hospital, that this man was separated away from his wife. I'm not sure of the strategies to address that. I know I can share what we have been doing in the hospital. So initially, people, I think others in this group had mentioned, they would FaceTime family members into their hospital. And I remember there was a patient in our ICU who had COVID who died. And we had a phone call, we had a FaceTime with him, and 30 family members joined on the Zoom call to say their goodbyes. But even that doesn't come, anywhere close to being there in person. Our hospitals, we have 3 hospital systems, and we've at each of the hospitals set up a volunteer team of medical students who have iPads that they go around to patients, and they schedule visits between their family members and the patients. But even that, again, you can only do it for 30 minutes or an hour a day, and it's hard to get an iPad for 1,000 people in a hospital. It's a lot of iPads, a lot of time. And some people just don't know how to use iPads. Some people are, the technology doesn't cover everything. The other aspect of it has been from communication of physicians to families. So usually in a hospital setting, there's always a family member that's there with the patient. So when we do our daily rounds, we can give an update to the family member who then tells the rest of the family what's going on. Now, if you imagine that there's no family members allowed in the hospital, if the patient is very sick or can't talk to the family members themselves, then it's the physician's duty to call the family members. So now imagine having to do a 30-minute phone call with a family member for 20 patients. And that's 4 hours, 5 hours in the day that we haven't, we usually don't have time to do that. But now it's our duty to do that. And you can imagine that it's a lot of conflict. Where do you find the time from? And how do we, give the patients the time and the attention that they need? So at our hospital, we have another team of medical students and residents who are working from home, who are looking through the chart to see the medical updates, and then they'll be helping us relay the information to the patient's families, just because physically the people working in the hospital don't have enough time. So those are some ways that at UCSF that we've tried to address these challenges. I think the biggest thing is that patients' families can be allowed to visit them in the hospital. But I'd love to hear what the rest of the group has to say on that.
So, Dr. Manoj, those are some really starkly disturbing stories, but you have seen them up close and personal, and thank you for sharing those perspectives for us, which we don't have otherwise. Those are amazing things to learn, and then you can just imagining the emotional burden that everybody goes through. It's unbelievable. Before I asked the panel, there was a few questions that are from the audience that have been watching this. So one of them is around emotional burden in adults is one thing. They can express well, or they can find avenues to do that. But how kids and teenagers, how their emotional burdens are identified and measured, and any suggestions to handle that? That's one question. And there is similar related question from another viewer. They have senior kids that are getting very depressed, the class of 2020, they call it. They didn't have the same deal as everybody else they've seen growing up when they graduate from high school. And additionally, they're not sure where they're going to go for college and how their first semester is going to be. So how do these parents that are dealing with this kind of teenagers and kids that cannot express, as sometimes they may keep all of that internally, what are your suggestions for such parents and how they can handle this emotional burden that runs without even having anybody impacted with COVID? just surrounding themselves with this kind of burden, what kind of advice you have? Maybe Manoj, you can start with, and maybe we can go around everybody else.
I can share what what I think could be some strategies, but I think we have a pediatrician in the group, and I'd love to hear her opinion. I think for me, what has been helpful is having a structure in my day. If I'm working from home, just maintaining a time that I get up and maintaining a time that I'm exercising, or scheduling a time for hobbies and scheduling a time for work, which when working from home can become very blended, and maintaining the structure maintains a sense of normalcy. I think that's one thing. And then I think these are hard conversations, but parents should be having open communications with their children about this is a very unusual time in everyone's lifetime, and that everyone is going through it together. And I wonder if that's one way to go about it. In terms of the older kids and college acceptances, that is a really challenging situation, and the world has never gone through this before. And I've heard many stories of college applicants who are just suspending their applications and coming back the next year because it doesn't make sense to pay $50,000 to go to a college when you're not able to be there in person. One, from an educational standpoint of being able to ask the professor questions, but two, from a social standpoint of being able to make friends and having the college experience. It doesn't make sense to pay $50,000 for an online education.
I'm going to go to Dr. Vivek and see, as a psychiatrist, what kind of recommendations he's got for parents that are dealing with this situation. Vivek, sir, can you unmute yourself?
Am I audible now?
Yeah, we can hear you.
Yeah, so I was saying that children who are young, children who are small, usually do not have the emotional impact of COVID directly. It is the indirect impact because of the lockdown, because of loss of their structure, and because of no meaningful things to engage in. And such things, as Dr. Manoj already said, can be managed by having a good structure throughout the day. So this is very important. Second is the children who are a bit older and then entering the teenagers. These children definitely have emotional impact of COVID, and it's very important that the family members do talk to them, share their anxieties, uh, comfort them, reassure them, give them a true picture. Also, the most important impact on the teenagers would be from the family themselves. The adults who tend to get anxious, who tend to get disturbed and restless by surfing the news, by getting misinformed or informed, do tend to pass it on to the teenagers. And teenagers learn the helplessness from the parents. So they realize that the parents themselves are helpless in this situation, and obviously, being younger, they are even more helpless. So the other crux is never to pass on their anxieties onto the kids. And obviously, as I said, do give them a platform to share their emotions. They may be wrong, they may be corrected if they are wrong, they may be reassured, and that should be it.
Go to Parul, you can chime in with your views on how to deal with this emotional burden, especially with, if you don't have anybody COVID, but how it's important.
Yeah, Bhaskar, I'll repeat your question because I think it was like breaking in the middle. So what I understand is it's about the emotional burden that's you were asking, and as Dr. Vivek and Dr. Manoj mentioned. So I'm not a pediatrician, but definitely I see parents, and I am a parent myself. So I completely was actually I was thinking the same thing that Dr. Vivek mentioned. The second part that he said about parents, how the parents behave is what children learn. So just want to make sure if you can.
Yeah.
Yeah, you can hear me. Okay, okay. I thought maybe I'm not audible. Okay, so as a parent, it's this is in general, whatever we are kind of role models for our children. The younger children and definitely older children, adolescent parents are what they look up to, and this is what I tell the parents who are my like neighbors and friends and family, and also my patients who are parents. I tell them that take this as an opportunity for your children to learn, because they will this definitely will end at some point, we know that. And once that ends, they this experience will stay with them. So let's make it a positive experience for them, so later on, and also actually make them rather than like being anxious and panic, actually tell them how they can look for ways to handle it better. For example, all these things, prevention and everything. So I tell my children, my oldest is 10. I tell them that as long as you're doing these prevention things, you can actually, this is a preventable illness. It's not something that's just going to attack you from nowhere. There is a way, it has a way of spreading, and if you do these right things, there is a solution. So I think that's my children are washing hands a lot. So I think we are actually we can teach children that there is a problem, and then there are multiple ways we can handle it or have a solution. And the way I look at it is, we don't know when something similar is going to attack us next time, and if we as parents would be around to protect or guide our children at that time. But definitely I think we'll have this reassurance that and I'm not talking about just our children, but our children in the society, that will have that reassurance that they will do better because they will have that experience from this with COVID-19. And same thing I tell my son. Actually graduated with his elementary school, and he was a bit disappointed that he couldn't do the regular graduation and he was doing the drive through. So I said, just think about it. You have many graduations to do, and all the children have many different graduation experiences, but this is a unique experience that will stay with you. And we took a lot of pictures, so have them have a positive spin on it, is what I feel.
It's great. Ask Dr. Sharmila ji to chime in with her perspective on that question from the audience.
Dr. Sharmila, you need to unmute yourself.
Hello, am I audible?
Yes.
Yes.
Yes, I mean, I couldn't hear your question, Bhaskar Garu.
So the question was on the same question that was going on with teenagers and kids going through the emotional burden. How should parents deal with it? And as a pediatrician, you would have some perspectives on that.
Yes, I have something to contribute here. See, if I have to summarize about how there are two aspects to it. One thing is, how are parents of children dealing with their own children, their emotions and everything, and how are children dealing with their parents' behaviors with their own issues. So this is kind of interesting and unpredictable, in the sense you'll see that my experience is that children are very well adjusted to the fact that there is COVID around. There is no fear, there is no anxiety about the life or things that you expect them to have. No. It's also because most of the parents are not discussing too much about the implications of COVID. They're only teaching them like it's one more virus and the reason why their life is restricted. And that did really help. I've seen, like, once the lockdown is lifted, I've been seeing regular OP, a lot of children coming in. In fact, there's little tiny tots. They're very eager to wear colorful masks, couple of them. Couple of them do not want the masks, do not want their parents also to wear the masks, and they're crying for the parents to remove their own masks. And they're kind of more horrified at seeing me now in full gear and all that when I'm examining them versus what I was before COVID, when they would spring up onto me, come and fall all over me. So there is definitely a change in the way they react to their doctor, to their own parents, and all these things. But it's not about the little ones, they're not aware of the deeper impact. And the older ones, very surprisingly, they know, I mean, at least in India, this is what the mood is, that they don't consider it as being too much fatal. They already know that you need to take care, and while you're restricting yourself, you are at very low risk. The only thing that I see in most of the teenagers or slightly older children, like from 10-year onwards or 8-year onwards, is that every single child till 20 or even later is that they're very worried about not having a routine and their usual life, their inability to meet their friends in person, how much ever you keep them connected with their devices and they're getting in touch with their friends and everything, the lack of structure is taking it all, and more importantly being unpredictable. How long are we going to stay like this? When are we going to go back to our usual classes versus the online classes that are going on? What is the future of the exams this year and the last year's exams? And here I have to tell you one interesting thing that's happening here. I think probably somewhere in Karnataka, there are parents protesting, saying that the children have prepared well for their 10th exams and now they're not being able to write the exams. This I find really funny, because I think this is a time when all of us have to be grateful about having a life, living around, while there are people unfortunate who are dying. And now, I mean, when you compare this, there is a section which is thinking very negatively, trying to get into the nitty gritty things about what they are losing in the lockdown rather than what they are having at the end of the day. I think the positivity should go up in the parents. This is for the viewers, whoever is seeing. Appreciate what you have. And in fact, this is one time I will definitely say there is a lot of introspection and catching up on things. And if I have to tell my personal opinion, I sometimes wonder if this is a kind of, on a philosophical note, whether all of us were given one good time to have an introspection where we are all racing ahead without knowing where we are all running ahead. And I think this is one time where you have to introspect, catch up on all those things, including your family ties, getting to know your children better, and spending more time with them, more quality time with them, getting to know their thoughts and all. And again, going back to the emotional burden, teenagers definitely are getting burdened about their separation from their friends, not having a structure. But then, I mean, the way that I tell my own patients, parents, and my own children is to see the larger picture in life, which I don't see most of the people are doing, even non-COVID times, that they focus on something very short term, losing the bigger picture in life. This 1 year of loss of usual academics or exams or your goals or reaching to college or taking things of your choice, this is very, very tiny when compared to the larger picture of life. This is what I keep telling them, to look at it this way. And emotional burden, there is not much fear of death here, at least here in Indian teenagers and Indian children. But yes, there is this I mean, depressed mood, because no one can is able to tell them when this is going to go back to normal. This is the main crux of the emotional burden for children. Till what time are we going to have these online classes? Till what time are we going to have this restricted lifestyle? And as the lockdown, I mean, opens up, still there is a warning to have the extremes of ages at home as much possible. So they're worried when they can go out, at least for a small dinner or lunch or meeting up with friends or having a game probably in a field. This is what is actually tiring them out. And this is where the answers are also very gray. I mean, you can never tell them this is going to be 1 more month or 2 more months. At the point at which we are there in, I mean, the situation in COVID in India right now, in Telugu states, we do not, the cases are exploding, deaths are not many, but we cannot predict what it will be 3 weeks later. There is this thought coming up about, will there be one more lockdown? All these unanswered questions are causing anxiety and depression in children. Other than this, I think they're handling quite well.
And so I'm going to go to Dr. Raghu and see what he's got to say. Raghu.
Yeah, being a physician dealing with the families. I'm a family physician. I deal with newborn to the eternal life. So I know what it is actually from the ground level and to the patient's level also. So what I suggest, as Dr. Vivek was telling to the kids, youngest kids, is to the parents especially, be with them. They don't have effect of corona on their minds. They are very pure in their minds and their lifestyle is the same. So be with them. For the younger kids I'm talking about, be with them. Let your COVID emotions affect them. Enjoy with them. Don't show your COVID emotions on them. For the younger part, enjoy with them. They have their own lifestyle. They love to play still. They love to draw still. They love to watch the movies still. Be with them and enjoy with them, as far as the younger kids are concerned. But as for the teenagers and adults are concerned, I have lot of things to offer there. Yes, it is valid. Whatever feeling you have at this point of time, please realize that it is valid. Take it from that point that your feelings are valid because the world is like that. But you have to understand the situation of COVID-19 as a whole. You understand that and you have a breakthrough through this isolation. There are many ways in the technology to break through this isolation. You can have your own public chats. You can have your media to talk to the people. You can have, make a family time, make a friend's time, sitting at home. You just take a break. There is something called, Dr. Vivek must be knowing very well, do something else. If you have something stressful to you, do something else. Don't watch out for COVID news. Don't watch out for COVID treatments. Don't watch. Yes, it is very important to know about the COVID, but there is some limitation to your brain to accept any information. Cut off there and have something else to do. This is always a beautiful, beautiful psychological technique that works out. Do something else. I think Dr. Vivek will accept with that and be physical self for you, because your physical mind, physical fitness will help your mental fitness. So make a point to exercise, make a point to have a physically active life and have your relaxation time increased. This is for especially teenagers who is having online classes, online exercises. Okay, all are there. Nothing will happen if you crash over the deadline. Nothing. It's not more than COVID. So just have your relaxation time. And please, all the panel are talking about anxiety and depression. There is something called grief in this. We have to accept that. There is a feeling of grief. There are 5 stages of grief, and we are, some people will be in the anger. Hey, what is this doing? What this virus is doing to me? Some says denial. There first starts with the denial. Grief starts with the denial. This virus won't help me. Don't affect me. They are in the denial stage. Anger. Hey, what is this doing to me? It is killing my life, my personal life. Cannot go out. I cannot come out. And there is something called bargaining. Okay, if I give a hand wash, okay, I can live. There is something called sadness. In spite of this, I cannot come out of this. And there is something called acceptance, where you will say that it is going to stay with you and I will learn to live with you. So be there at the level of acceptance. Yes, there is a grief, not only emotions of stress and anxiety or depression. There is a grief in this whole phenomena. So accept it. COVID-19 going to be there. We can't say that for next 6 months. We cannot avoid that. So accept it and try to live with that, with all the techniques and with all the safety measures, with all that acceptance of the grief is a very good phenomena, or another very good technique, psychological technique, to overcome the whatever burdens mentally you are having. And the last point is, be there. We are all here as a doctors to help you out. Please reach out if any kind of problem which you cannot face out. For teenagers, relax. It's not only the deadlines. Relax your time. Have a beautiful time with the family. This is the take it as a gift from the God. God's given gift. How many of us will sit 8 hours in a day with the family? How many of us? I don't think so. So take it as a gift from the God. So accept the condition. It's unfortunate. Nobody created it. It happened, and we have to face it. Accept the condition and live happy and break through the isolation with many ways. Be positive. Thank you.
So as a non-doctor, I have few uh, points that I can offer to the teenagers. If anybody is depressed about this particular thing, look at what COVID has done to, many of you guys, teenagers, have been making a lot of noise about how we've been ruining the environment, that we haven't done enough to protect the environment for you guys, for your future, that we've been having bad policies. Now, COVID, in a way, forced us to create this atmosphere, the environment that is now getting beautifully ready for you. It is actually, that's how I would look at it, saying the world is going through a cleansing process. The whole atmosphere, the environment is going through a cleansing process for you guys, so that your generation can have a beautiful world tomorrow that is going to be waiting for you. So that thing you need to look forward to is stepping out into the new world tomorrow. So with all the full rigor and energy, because this world that is waiting for you, once everything else settles down, we defeat this COVID-19, which we will. It's just a matter of time. Just a matter of time. We need to be patient. We need to be patient to wait for that opportunity when these wonderful doctors that are part of this panel, amazing research that's going on around defeating this thing, eventually we will prevail over this. When that happens, you need to be around with all the mental and physical strength possible. So that is what you need to be looking forward to as a teenager. It's not going to happen tomorrow. It's not going to happen in a month. Just like everybody else has been saying, there is no timeline for this. But the timeline that you need to be looking at is way beyond what you can even imagine. It is about next 10 years, 15 years. And that's, as teenagers, that is what the world you will be owning. You will be the one leading the world into that. So having yourself equipped with tools and techniques, mechanisms to kind of own that world that is getting cleaned up, that's getting ready beautifully for you. So look at it from that point of view. Channelize your depression into mechanisms that are going to make yourself ready, make your group of your own friends ready in all the mechanisms that are available for you. You don't have to necessarily physically meet, but you can still do wonderful things together. Technology has been a boon for the mankind in this situation. Just like we've been sitting here in everybody's own home across the globe right now and talking about this emotional burden as a problem that we're all dealing with. So technology can do wonders, and it's the one thing that is working very, very well for us. So use that as a teenager, as the smartest brains around currently on earth. So focus on things. How are we going to own this world tomorrow? How are we going to lead this next generation of issues that are going to be opportunities, I would say, that are going to be around for us. So it is your world waiting for you to own it. So be excited about that, because that is a wonderful opportunity that you will be walking into. So that would be my advice on how, as parents, you want to excite your teenagers, channelize their energy into things that are going to make a difference in the future to come. So I'm going to have next 10 minutes. There was one question though, which is not related to the emotional burden, but it's a medical question from the audience. There is a rumor that's going on here. Yeah, Dr. Manoj have to leave now. Dr. Maddali, thank you for that amazing piece of information that you shared with us. The story of the couple that's been married for 75 years, getting separated because of this, and the emotional burden that you have to personally endure, and the lessons, that reflections that you had from that. It's an amazing contribution to this panel today. Thank you on being on the front lines. Be very, very safe. Our thoughts and prayers are with you all the time. And then you be very safe, Dr. Manoj, and keep doing what you're doing. It's an amazing, wonderful thing.
Thank you, Bhaskar, and other panel members.
Thank you for your time today. And then if the rest of the panel can hang on for a few more minutes, there is one question that's making rounds. I think it's the WhatsApp University where these things kind of make rounds, that blood group with A+ are more prone to COVID-19. Is that true? Is the question. It's a medical question, so anybody can take it.
I will take it. It's a hypothetical question. It's as a WhatsApp University only. No proof, no data. There is some other thing going on around. I want to before somebody else ask it, I want to tell it. Baldness has got something to do with the high fatality, or even that one is not acceptable. Data is there. Only 500s in lakhs of cases will not support that data also. These are all. That's what I said to you before also. Understand COVID-19. Talk to the professionals. Don't go through the WhatsApp University. This is no.
Correct.
Absolutely no from my side. No data to support that.
So excellent. So that if you have any questions for each other around the emotional burden,
and I want to on the emotional takeover, I will tell to the audience who are watching it, please focus on what is in your hands. You can't do anything which is outside happening. So focus on what's in your hands and be there with your family and try to be with you everything. Try to be doing everything in your limits with your family and don't go out. This is the thing. Yeah, Dr. Sharmila?
Yeah, Bhaskar garu. I was like, and Raghu garu. Yesterday, I had a parent asking me this very question about the A positive blood group. So what I told him is, when you compile data and you keep on, that's how studies get into place, that's how protocols get into place. When you're compiling data, when you check across the list of variables that you can just measure and see and all those, one compilation could be that when they've seen when they're compiling the blood groups of all these COVID patients or morbidities, they must have correlated that there are slightly more number of A positive blood group there. But then what we need to know is, will having the blood group predispose one person more than the other, is what the parent wanted to know, which I said is definitely not. There can be numbers showing, see, out of 100 patients, say 30 patients are from this blood group and 30 are like that. They're compiling data, but that doesn't causatively correlate to the blood group people having the disease. That is number one. The second one is like about children. The other thing I wanted to say is, when at home, actually, there are these two extremes of things happening. People who are very much aware of children spending too much time on screen and all that, with their anxiety to not let them spend time at all, they're making the day hyper structured and then constantly checking on them, because one of the parent is 24 hours at home right now, breathing that down their necks, not giving them any calm time and wanting the day to be utterly productive. They're going overboard about that, and that is very exhausting for children at home. They would have some time away from parents all this while. They would go to school, hang out with friends, and then come back, play with friends and all that, because that is not around and they're constantly under scrutiny. It's extremely tiring for children to be constantly scrutinized. These are for those parents who are hyper scrutinizing their children.
How about shifting the discussion towards, we talked about children, all right, but there are couples that are now spending a lot more time at home than they were otherwise. So if both of them are working, you usually see each other maybe an hour or two in the evening, dinner time, casual conversations, you sleep, you go off to work next day. Now you're pretty much surviving with each other under the same roof. So I want to hear, Dr. Vivek, what do you have? How do we save our marriages?
Because they are already prisoners like, so you have the experience, and fortunately or unfortunately I too have the experience of dealing with the prisoners in Brunei and Saudi Arabia.
Okay.
So you can add on to that, because they are equally emotionally present themselves, so you can talk to them about. I was about to ask the same question Mr. Bhaskar asked you.
Basically, see, it's like this. Because of our schedule, we spend a limited number of minutes or hours with our family, and we are used to get emotional discourses, whatever, in that time frame. Now, what is happening is, now since we have more time at hand spending with each other, we end up escalating our problems. One, what we are doing is we are discussing more about the COVID. So the couple, the family discusses more about COVID because of the extra time at hand. Second, they start living more like hostlers. Initially, they were like two people working elsewhere and just sleeping together. Now they are living together the entire day. So they have started finding the deficiencies of each other more. So that is also a point of contention. See, my suggestion to this as well as to other problems is this is also I'm taking the liberty of just extending the talk about a minute or so. This is also for the general public, general audience who is paying attention to this. Despite the fact that there is a lockdown and there is an increased time at hand, it should be a structure. Give structure to your day entirely. You can have more free time, but that free time should also be well spent. So structure is very important, so that there are no negative thoughts about each other, about the family members, about COVID, whatever. And this is also a flip side to it. Having a free time is like developing many addictions. So it could be internet addiction, it could be gaming addiction. Instead, we should replace those addictions with positive addictions. So spending time reading, spending time painting, drawing, whatever long forgotten hobbies you can bring back. Limit the sources of information about COVID and limit the discussions among the family members. There is a data, have a reliable source of data, whichever you trust. Discuss that for 10 minutes, that's it. And also people have started self-medicating themselves. I know people taking alcohol just to get over the anxiety, and I also know people popping pills to get over the anxiety. So avoid that. And in the end, try to find the positives in each other. Try to encourage each other. For example, a kid can be encouraged to paint more, or a spouse can be encouraged to pursue her hobby, which he or she had forgotten down the line. And last but not the least, in general, I'm re-emphasizing it, though this is out of the context a bit, that since many people have pre-existing mental illnesses, and sometimes what happens is a lockdown period makes you non-compliant to the medicine, non-adherent to the medicine, but you do not relapse very quickly. So once you do not relapse, you tend to feel that maybe I'm out of this illness and I won't have a relapse again. Please don't make that mistake. If the lockdown enforced a non-adherence, please go back and check with your doctor, whoever was treating you, and get back on medicines. So I've taken my liberty without even asking you about extending my talk.
No.
So
there is
Raghu, I want to ask Dr. Parulji, see what she got advice for couples.
Yeah.
I think I definitely, Dr. Vivek has a lot more perspective on this. I'm married, but one thing I've seen, that's just my experience, that a lot of people, because they're spending a lot of family time and couples and children, I think there is a lot of positive stories that also I'm hearing from my patients also, like and definitely on social media you hear those things as well. So I think by spending time, you're getting to know your partners better. People are doing and pursuing their hobbies a lot. I'm like part of some groups that I'm like seeing people are like something that they used to paint like 20 years back, they have now picked up. And a lot of people, because when you have free time, definitely there is a negative side to it as well, that you could get addicted to things, or like computers, or maybe too much of together time can have some adverse effect on your relationships. But in my opinion, having a lot of time, free time, overall, at least that what I have seen has been pretty positive. I feel that having more time with family and with couples together, being able to spend more time, in my opinion, is always positive. We always say we want more time, we always wanted more time with family, and this is now we got it. I think we're probably going to be ending it soon, so I just want to make a quick, if it's okay with you, Bhaskar
Sure.
Garu, ending comments. First of all, thank you so much. It had been really a great panel discussion, and thanks for calling me back on this. I think 3 points that I was thinking during this discussion. One is that Dr. Manoj mentioned, which I think is a very important point, about the healthcare workers or doctors, nurses, how they are, getting affected with it. And we're going to see its impact. We have already started seeing it, but I think later on we'll see more of its effects, and which is more depression, and what we call moral injury, that they feel that they're not able to do enough. So I think that is something definitely to be watchful of, is what I feel personally. The other is, one point that I actually recently found out is that I want to make is depression rates are already going up. Zoloft is one of the antidepressant medication very commonly prescribed in the US, sertraline. It is already on back order. So it how much people are getting affected emotionally, obviously financial, political, all those things are part of it, but definitely the underlying issue is COVID-19. So we have to be very much watchful. The third comment I'll just very quickly make is about the acceptance, which was mentioned earlier about this panel. And acceptance is really the key here. Acceptance that it will end. I always tell my patients, in 1918 Spanish flu ended, and yes, there were a lot of damage, but it ended, and there were like obviously majority of the people did survive, and it was so I think that is the key, and that was 100 years back. Now this is something we are so advanced that you can imagine will do much better and will end it much faster than that. So definitely it will end. There is nothing to panic about it, but don't think about when it will end. I think when we talk about we have these in our religion, and a lot of experts on positive thinking talk about it, that stay in the moment and be alive in the moment, and don't let go of things that you don't have control over. And this is something I have been hearing since childhood, that my mom has been telling, and our religious texts say that, texts say as well, that let go of things and you'll feel better. And I think this is the moment, this is the time for us to practice that. And personally I've seen also that when we actually let go of this thought, that we can't control when it's going to end, we do better emotionally. So these are just the 3 points that I wanted to make.
That's
Yeah,
that's excellent,
just
Dr. Parulji.
just a
So
one minute talk from my side. There is some poster on the left shoulder of Dr. Vivek Rustagi. Don't worry, be happy. Be there. And just want 2 minutes quick comments from Dr. Vivek for our colleagues who are really stressful. Any tips from your side as a psychiatrist? Just 2 minutes for us as a medical panel.
The major tip that I would like to offer to the people who are obviously much more intellectual than I am is being in the thick of things, we are much more aware of the information and the policy changes and everything. And sometimes it is very frustrating. So we are doing our work, the policy changes, we do not like it, but we still have to work according to the policies given by the dispensation and all. So my advice is to dissociate yourself from the work for some time, at least in a day. So do your work according to the policies, according to the guidelines that you have. But once you are back, in that time, try to stay away from COVID. Like Dr. Parul said, have some positive time with the family, have some positive time with the kids, with whomsoever, socialize in a positive manner without discussing COVID and all. So that is all I can say for the healthcare workers.
That's great. So thank you with that remark from Dr. Vivek and Dr. Parulji. I want to thank all of you. I know Dr. Srinivas and Dr. Manoj have to leave because they're on an emergency call, but your time is very, very, very valuable. And your health, when I'm saying your health, your entire clan, that the entire family of doctors around the world that are doing amazing work for us, to the humankind right now. I don't think we can ever measure the intensity and the impact of the contributions you're making. As doctors, you all are privileged. Probably it's a boon for you to be in that space, to be of help for the humankind. And we all should be indebted to you. We're all praying for the health of you guys. So everybody that is helping you, the nurses, the healthcare workers, and entire supply chain of people that are surrounding you guys, to make sure everybody else is safe. And your advice today on the panel is immensely valuable for everybody that's been tuned in. I'm pretty sure the link will be looked up by people later on as well. This is recorded on YouTube, so everybody will watch it later and will find this advice and the discussions that you guys presented from your true experiences. And this will be very, very useful, because when people get confused, the only source to turn to is the source of truth, which is you guys. And thank you again for your time, for coming on board today on the panel, and spreading your heart and vision and the knowledge for the viewers and everybody else. Thanks again, and you guys be safe. Let us clap for everybody. Let's clap again for everybody that's been serving this.
Thanks to the entire panel again.
Be positive, be positive. That's the only way to be in these conditions. Thank you, guys.
Thank you.
Thank you.
Bye.